Wait, can you see on the screen? Cool. All right, everyone. My article is called Exercises to Prevent Low Limb Injuries in Youth Sports, a cluster randomized control trial. The authors introduced this topic by stating that physical activity in childhood and adolescence has been shown to decrease risk of physical impairments later in life. We as PTs know this. Next, they state that youth sports are how most children and adolescents get their exercise, but it's also where most injuries occur, and this is kind of the theory for their whole article. They also state that most youth sports injuries are at the knee and the ankle, and this is something they specifically focus on in the article. Next, they state that most injuries are avoidable. A lot of these are from children like not knowing how to use their bodies for sport because they're more uncoordinated until they reach maturity or adolescence. Sprained ankles and all these avoidable injuries that training and things along those lines that can prevent. And their whole theory for the article is that a proper warm-up routine may help prevent injuries during training in sport. To be specific, their objective from the article was to, quote, investigate the effect of a structured warm-up program designed to reduce the incidence of knee and ankle injuries in young people participating in sports. So for the study design, it was a randomized control trial. They used 123 handball clubs in central and eastern Norway. There are 1,837 total participants aged 15 to 17, 1,736 women, 251 men. And then the teams played 20 to 50 games throughout the season, and then they practiced 1 to 5 times throughout the week, depending on how casual or intense the club was. So for their methods, the experimental group had a protocol that was performed at the beginning of every training session for 15 consecutive sessions, and then once a week during the remainder of the season. 808 women and 150 men were in that group. Before we get into the protocol that they used, the control had no specified warm-up routine. They were instructed to do whatever normal warm-up their club did for the entire season. That wasn't specified what it was, but it was known to be less intense than the protocol that's on the screen. So they start with warm-up exercises, 30 seconds and one time through for each of these, jogging end to end on the handball court, running backwards with side steps. The coach would say left or right, and they would take a step while continuing to running backwards. They would do forward running with knee lifts and heel kicks, like butt kicks and high knees. Sideways running with crossovers or karaoke. Sideways running with arms lifted or a parade. So when your right arm goes up, your left leg goes up, like you're leading a parade. Forward running with trunk rotations. When your left foot hits the ground, you do a right rotation and vice versa. And then forward running with intermittent stops. The coach or the trainer would say stop. They'd stop on a dime to a complete stop and then continue running. And then a speed run, which is a sprint. For technique, balance, and strength and power exercises, they do one of these per practice and they rotate through them. So for technique, they do planting and cutting movements. Then it wasn't specified how they did these, they just did them. And then jump shot landings. So in handball, it's like spiking a volleyball. There's like a 3-point line looking thing on the handball court. You have to jump from behind and throw the ball at the goal. You take off with one leg and land on 2 legs after you throw the ball. So that's what that one is. For balance, they'd be on a balance mat or a wobble board, depending on what they were able to do. So they pass the ball with a 2-leg stance, squat on 1 or 2 legs, depending on what they were able to do. Pass the ball on a 1-leg stance, bounce the ball off the ground with their eyes closed, and then push each other off balance or just give each other perturbations to where they didn't fall over, but they were challenged enough they had to use a strategy to recover their balance. Then for strength and power, it says they had to do 1 quadriceps exercise each, even though a Nordic hamstring curl is listed. I don't know why that is, but squats to 80 degrees of flexion, a bounding stride, and then a forward jump, and then a jump shot, like I said earlier, with a 2-legged landing. And that was the protocol that they used. So for the outcome measures, primarily, like I said, they're looking at acute injuries to the knee or the ankle in practice or in sport. And then secondarily, they're looking at injuries to the upper limbs or the lower limbs that weren't the ankle or the knee. And they defined an injury as any event that occurred during a scheduled match or training session that caused the player to require medical treatment or miss part of the next match or training session. So as for the results, they found that the experimental group had less injuries overall than the control group for the overall number of injuries, lower limb injuries in general that weren't the ankle or the knee, acute knee injuries, acute ankle injuries, and upper limb injuries as well. All these were statistically significant except for acute ankle injuries, and that's what I've highlighted on the screen. So acute ankle injuries. Next, they looked at injury severity as well. I'll get into how they classify that first. Slight is 0 days of absence and able to participate fully in the next match or training session. Minor is missing a match or training for 1 to 7 days. Moderate is 8 to 21. Major is over 21 days. So what they found is that the experimental group had less severe injuries overall at the ankle and the knee specifically. Major and moderate severity injuries were significantly decreased at the ankle and the knee when using the protocol, but minor and slight injuries showed no significant difference. So if you end up working with some sort of sports team that has a lot of major or moderate injuries, you could give them this protocol, and theoretically it should decrease their injuries throughout the season. Lastly, they looked at injuries that happened in practice during versus a match or like in game. And what they found is that the experimental group had less overall injuries during matches, but not during training for the acute knee and ankle. And that's what I have highlighted on the top of the screen, showing that it was better for matches and not during training. There was no difference during training. And the control group had a higher number of injuries in both practice and matches overall. So the experimental group was better in that regard. So you may be wondering, how does this apply to runners if this is a handball team? Well, warming up is a crucial aspect of running, and these athletes do run multiple miles during a match. It just involves more sprinting and plyometric movements like running, cutting, things along those lines. Also, running and gait analysis requires more setup and potentially more money, whereas a warm-up, if you have a good coach or just a good document to refer to or someone that you know to refer to, this can save a lot of time and money without actually having to go through all the gait analysis. This also could address issues with muscle activation without needing for gait analysis. So if you do a warm up or you have someone who knows what they're talking about on your team saying, oh, this kid's missing glute activation, they have afraid to go into knee flexion, a good warm up could substitute for having to use PT visits or go to a running lab like we have here with all that costly setup as well. So these are things to just keep in mind. So to conclude, warm up exercises centered around the ankle and the knee joint neuromuscular control, impact absorption, and strength surrounding muscles aid in reducing injury in youth athletes. Lower limb, upper limb, and knee injuries can be reduced by following this protocol. Then moderate and severe injuries can be reduced when using this protocol. There were some weaknesses in the study I thought were important to point out. A control group's warm-up was not explicitly defined. We have to know what we're comparing the experimental group to know how effective it is when compared to other strategies. Next, there was an unequal distribution of sexes within the groups. They're mainly female. Females have a larger Q angle and are more injury prone. With a lot of sports, there are more injuries overall compared to men in the same sports. And lastly, there are large differences in the number of games played per season and days of practice per week. It was 1 to 5 times per week and 20 to 50 games. Some people were playing 2.5 times more games in a season, which could be leading to overuse injuries as well. So that's something to keep in mind. So after some discussion, the first point I wanted to discuss is that the participants in the study were all aged 15 to 17. Do you guys think these findings apply to younger athletes or just to this population? I think it applies to anybody. Okay. What do the rest of you guys think?
That improving coordination can reduce risk of injury in any age group. So if they were to put this, I'd be curious to see how it affects I guess younger children whose growth plates aren't fully developed yet. They're still in the process of developing, they're still growing a lot, especially because those tend to be the most uncoordinated kids because they're growing so much per year. But I think it'd still be applicable to everybody who has these impairments.
Yeah. That's something I was also thinking about is that I remember in our sports elective, we said that kids are still trying to explore their degrees of freedom, especially when they're really, really young. So being a little more uncoordinated when you're younger could apply to this. I'd be interested to see a study that kind of ran this protocol on children that are younger than this. The next point I wanted to talk about were, do you feel like the article would have turned out differently if a different population was chosen since handball requires different movements than running or other sports? Do you think just because they're handball players, do you think you can extrapolate this data to other sports?
Say yes. I would say that most sports have some aspect of quick movement plyometric type of activity. So I wouldn't say it's limited just to handball. obviously there's some sports that don't require as much, explosive movements like golf or something like that, but like, like football, soccer, those kind of things, it definitely could apply.
Yeah, I totally agree. Anyone else?
Yeah, agree. Yeah.
Same.
Cool. Yeah, I was thinking a lot of the same thing, other than maybe just like a straight up endurance run or something like that. That might be a little different, but I think it does apply. Neuromuscular control, impact absorption, all that stuff's kind of transferable. Lastly, do you think addressing a warm up should be looked at prior to a gait analysis, or do you think you just do gait analysis, or what's your thought on doing both, or just one, or just the other?
I almost think that so whenever we do your analysis in here, obviously we're doing like 5-minute walk and then a 3-minute run. I almost think that walk kind of serves as your warm up.
Mhm.
That could just be my interpretation.
If you want to mimic what the person is doing, if they have, like, are you warming up? Having the thing. I think you should try to mimic what they've been doing already.
Yeah,
So
totally.
like create the same environment.
Right.
Yes. Yeah,
Yeah.
yeah, I agree.
I would also say that like, especially the warm up needs to be like effective. Like, a lot of times, a lot of kids just go through the motions, like walking through a line stretches that their coach gives them. But like actually making it like an effective, like breaking the sweat to actually know you're warmed up type thing.
Mhm.
I think that's probably the most important part of that, like, is addressing the proper warm up more than just the warm up in general.
Yeah, absolutely. I totally agree. I definitely think it needs to be sport specific, and you can't just tell someone to run up and down the court or run 5 laps around the track to warm up. Absolutely.
I think
Awesome.
It's really important that you like look at a warm up if the patient like is telling you, yeah, my pain starts occurring before I even get into a full run at practice.
Mhm.
If they're telling you that it's happening before them, then you probably should be looking at everything, like Lane said, kind of.
No, yeah, I totally agree. Awesome. Well, thank you guys for your participation.
Thank you.